friends, my name is Dr. Deepak and I'm a plastic surgeon. Today I bring to you a very interesting thing. Sometimes unfortunate things happen and a part of the limb gets severed. Most commonly it happens to fingers or hands. So what to do in such a situation? How to preserve that part? How to transport it to make sure that you get best results? So humans have developed from simple celled organisms to complex organisms now, and we don't have the same regenerative capacity as the simple organisms. For example, you must have seen a starfish. If it loses a limb, it again regrows it. A lizard, if it loses a tail, again it can grow it back. But humans, if a part is severed, if it is not reattached, it doesn't grow back. So the best way of healing is that you reattach it. Most people don't know how to transport the material, and that leads to unfavorable results. So let's begin the video. I hope you like the video. If you like the video, then like it and subscribe to the channel if you like it. We'll come with more content like this for you in future. So let's begin. So whenever you have a limb that has been severed, that has been cut from the body, what you do is, supposedly, I'm just giving an example, and this is a part of the body that has been cut. You don't put it on ice directly. If you put it on ice directly, it is damaged. So what you do is, you take a clean piece of cloth like this, moist it in plain tap water, or if you have a plain saline at home, then that's wonderful. Even if you don't, then just wrap it up and put it in a box like this. Now you close it and you put this box in a bag of ice. So the cut part should not be in direct contact with the ice. So you put the cut part in a clean cloth or a gauze piece like this. Make sure that it is moist, nicely moist, and then put it in a container and put this container into a piece of ice containing ice, and then you transport it. It is preferable that you reach a good center capable of handling reimplantations or such injuries within 1 hour. It is the golden hour. If you reach a facility in time, then the chances of attaching it are the highest. Now, to reattach a limb, it is always better that such a transportation is carried out very meticulously. In case this part is damaged during transportation, then there is no use of going to the hospital, because ultimately you will land up with an amputation. Now, I'm just going to show you a short case which we did a couple of months back. A doctor came to us. She was working in the kitchen and the part of her finger was cut off. What we did and how it fared, I'm just going to show you. So this is the part of her finger, part of nail and some part of skin was cut while she was doing some work. This is the other angle. Okay. So with such distal injuries, it is very difficult to find blood vessels. There are no arteries to anastomose, there are no veins to anastomose. In such cases, we do something called as composite flap. Now, surgically, we reduce the metabolic requirement of this cut part and reattach it, replace it on the cut end. This cut part will act as a scaffold on which new tissue is overlaid by the body. So body already has a framework over which it repositions tissues, and ultimately in a few weeks patient has a perfect healing. Now I'll just show you how it looks after 15 days. Now we reattached it, and this is how it looks after 15 days. You can see it is held together with the help of sutures. Now you can see a definite difference between the composite flap and the rest of the skin. The composite flap is looking a little bluish, whitish, So this is acting as a scaffold now where healing is happening. This is acting as a framework on which tissue is being overlaid by the body. This is how it looks from the sides. You see this side skin is almost as the same color as the rest of the finger. So this is where the healing has become optimum and it is better. Now let me show you what happens after 2-3 months. So this is what happens. That tissue which gave a framework allowed a perfect healing of the finger. As you can see, if you see closely, if you see here, you can see an edge where the finger was cut. However, the shape is perfect. If you see the nail is perfect and there is no deformity. Now in this case also, the patient came to us on time and the tissue was perfectly preserved. They had contacted us beforehand only, and we told them how to preserve it and bring it to the clinic, and we were able to give her a good result. So this is how you preserve it, and always make sure that you are able to reach a center which specializes in reattaching severed limbs, or which does this sort of work regularly, because these are very specialized surgeries and not every center is equipped to handle such trauma. I hope this helps you out. If you have further questions, if you want to know more about this stuff, let me know in the comment section. We will try to help you out. If you like the video, just like the video and just hit subscribe for the channel. Thank you. Bye bye.